Beth Macy, welcome to Traverse City. Welcome back to Traverse City.
It's so great to be back. I had the best time when I was here. I think it was just about a year and a half ago, and it was a great crowd. And appreciate you all coming out. I know because I've talked about this book now, it's just been out 3 weeks, but I know there are people here who have lost people or know people who have lost people, and I just wanted to start by acknowledging that and saying that this is a tough topic, and thanks for coming out to talk about it.
Thank you for this amazing work you've done. This book is just, there's so much reporting that went into this. This must have been countless hours of work, and it's a great gift, I think, especially to people who have been on the front lines themselves.
Thanks. I've said a few times the only way I could really stand to live in this material for 2.5 years, and some of my stories go back to 2012 because I initially reported on heroin when it hit the city of Roanoke, Virginia, where I live, and the suburbs about 2010. So some of the families I've been following since about that time. Did a 3-part series in 2012. And I decided to tell this book through the people, the families, and the first responders who were fighting back, because they're so heroic. One of my friends who was worried about me at the beginning, a writer named Roland Lazenby, he said, I'm going to quote Mr. Rogers, find the helpers. And I thought that was really good advice.
Was that, had that idea occurred to you, or was that a brand new thought about the approach for your book when you said that?
It kind of was, and it kind of made it feel more manageable in my mind. I had the story of the origins of the crisis with the arrival of OxyContin, particularly in distressed rural communities, and so I chose to tell that through Central Appalachia, which is about 4 hours west of Roanoke, where I live. And then I had the idea that I would tell it through 3 Virginia communities that I believe represent the arc of the epidemic as I witnessed it, and sort of Virginia could then stand in as a microcosm for the whole country. And connecting those 3 communities is this interstate highway called I-81 that people in the region call the heroin highway. I mean, every state has its own heroin highway, I suppose. But I thought if I could sort of track it, then I could kind of understand myself and help people understand how it is we got to this moment in history where 72,000 Americans died of an opioid overdose last year, up 10% from the year before.
Maybe you could tell us a little bit about these communities, and I want to start with a quote from the epigraph, because one of the notable things about the epidemic is that it seems to strike everywhere and anyone, and you quote a physician from the late 1800s who said this evil is confined to no class or occupation. It numbers among its victims some of the best women and men of all classes. But through your book, you really show that some communities are more disposed to be hit hard by this. Could you talk a little bit about that?
Sure. So when OxyContin came out in 1996, Purdue Pharma, its makers, hired an army of sales reps and sent them out to communities where doctors were already prescribing high numbers or higher than average numbers of opioids, so competing opioids, Vicodin, Percocet, Loratab, et cetera. And so what they ended up doing, they bought the data mining information from IMS Health, and they sent their reps to these regions. And these tended to be places where coal mining, where there were lots of workplace injuries, coal mining, furniture factories, the towns I wrote about a lot in Factory Man, which was my first book, which was about the aftermath of globalization. So the same time you have OxyContin breaking out as a huge problem with overdoses and crimes in the late 90s in Central Appalachia, you also have it in fishing villages in rural Maine, and I'm sure in rural Michigan as well. And the reason that happened is because you had this sort of pernicious parallel problem of doctors being told that this drug was safe or was only addictive in less than 1% of cases. And the reps would try to get the doctors to write for OxyContin instead of these competing immediate release opioids, because it was said to be less addictive. And of course, the FDA allowed them to make this squishy claim that the time release mechanism, which allowed it to sort of bleed out over 12 hours, made it less likely to be abused and to make people addicted. And of course, we know now that people very quickly figured out an end run on the time release mechanism. So in these little rural towns, people were walking around with green and orange smudges on their shirts. So these were the 40 and 80 milligram pills. And they figured out that if they put a pill in their mouth and let the coating melt off, that was the time release part, then they wipe it off in the shirt, and they were walking around. And so as early as 97, 98, police officers in these rural communities where the jobs were going away at the same time were seeing diversion, illicit sales on the street.
And why was that so different than the drugs that were already out there?
Because a drug had never been made that potent before, an opioid. This was and it was supposed to be safer because it was supposed to bleed out over 12 hours, but because people figured out an end run, users could then crush it or inject it and get the full euphoric rush. And people who had been legitimately injured before, I mean, I talk about a 75-year-old miner and farmer who had been injured before, had lost a finger, and he was doing low coal, which is kind of on your knees, you know, in a cave-like situation. And he had taken these, lower dose opioids, immediate release, and had always been able to then function again. But the difference with OxyContin is it turned many people into non-functioning people, such that one man, for instance, traded his family mule for 4 OxyContin pills. High schoolers were overdosing in the Lee County High Library. Farmers were losing their farms. They were losing their families. There was a grocery store clerk was murdered as he was making the night deposit in a little town because somebody didn't want to get dope sick. He wanted to steal his money and go buy more OxyContin.
Why don't we hear a little bit from your book? Maybe we should ask the audience, who's been able to spend some time in Beth's book? Just a few.
Maybe about a 4.
Who has? We should also ask this: Who has dealt with this crisis in their own home or with close loved ones?
Yeah.
So, Beth, we agreed you'd read a little bit from your prologue.
Yeah. So I have this friend, Andrea Pitzer. She used to run Neiman's Storyboard, which is a narrative writing website. And she's always giving me advice on how to structure books. And I don't know if you find this interesting, but I had all these stories and I wasn't sure quite how to structure it. I knew I wanted to tell the story of OxyContin in the coal fields because this country doctor was fighting back, and he was my hero in that area. I knew I had these women who were trying to divert people from jail and into treatment in Roanoke, where I live. And then I knew I had this really compelling sort of heroin ring story in a farm village. And it was a lot to juggle until I figured out how the 3 basically went together in my mind and on this giant outline that I had on my wall. And my friend Andrea Pitzer said, don't forget in the beginning to tell the reader how to read your book, which was like, I hadn't thought of it that way. So this is the part I read where I just sort of lay out how the book is structured. Set in 3 culturally distinct communities that represent the evolution of the epidemic as I reported it, Dope Sick begins in the coal fields in the hamlet of St. Charles, Virginia, in the remote westernmost corner of the state, largely with the introduction of the painkiller OxyContin in 1996. From there, the scourge not only advanced into new territories, but it also arrived via a different delivery system as the morphine molecule shifted from OxyContin and other painkillers like Vicodin and Percocet to heroin, the pill's illicit twin, and later even stronger synthetic analogs like fentanyl. As the epidemic gained strength, it sent out new geographic shoots, moving from predominantly rural areas to urban and suburban settings, though the pattern was never stable or fixed. Heroin landed in the suburbs and cookie-cutter subdivisions near my home in Roanoke in the mid-2000s, but it wasn't widely acknowledged until a prominent jeweler and civic leader, Ginger Mumpower, drove her addicted son to the federal prison where he would spend the next 5 years for his role in a former classmate's overdose death. And this is the story that I covered in 2012. The young man had died in 2010. I covered Spencer's transition from private school student to federal inmate. At the same time, I witnessed the rise in overdose deaths spread north along I-81 from Roanoke. It infected pristine farm pastures in small northern Shenandoah Valley towns as more users propelled the addicted onto the urban corridor from Baltimore to New York. If you live in a city, maybe you've seen the public restroom with a sharps container or witnessed a librarian administer Narcan. While more and more Americans die of drug overdose, it is impossible to not look back at the early days of what we now recognize as an epidemic and wonder what might have been done to slow or stop it. In this section, the prologue begins with a mother whose son has died at the age of 19, asking me to go to prison to interview this drug dealer who's landed in the town, the small town, rural town, and sort of turned it from a handful of known users to hundreds almost overnight. Her name's Christy. Christy Fernandez's questions are not hers alone. Until we understand how we reach this place, America will remain a country where getting addicted is far easier than securing treatment.
What are Christy's questions?
So Christy doesn't understand how it is her beautiful son, he was a burly football player. She knew he had had some snowboarding and football injuries, 15 or 16. She doesn't understand how he ended up dead on somebody else's bathroom floor. And her questions are, how did I miss this? I thought it was only pills, she said. And so I did what we do in journalism. I just started pulling strings. I interviewed the cops that were sort of tracking, ATF agent, prosecutor, local cops were tracking this largest heroin ring at the time in Virginia. And then the reason I started following this is because I had gone back to the prosecutor that put Spencer Mumpower in prison in 2012. And I asked him to tell me what was going on now. So he pulls out this chart of 84 names, and these are people who've been sentenced on state and federal court charges. And at the top of the chart is this dealer that I've gone to visit in prison, his name, Ronnie Jones. Some of the names at the bottom are X'd out because they've died of overdose. And then I started interviewing people in prison that were sort of at the middle of the ring. And at the top of the chart is FUBI. That's what they've named the chart, the ring, informally. Can I say a bad word here? Okay.
We might have to bleep it on the radio.
But he didn't want to tell me what it stood for. So you know how when they catch a low-level dealer, the whole goal is to turn them into a confidential informant to get them to squeal on the person on top, because they always want to get the highest level. Confidential informants, it's called. And so they had one guy in the middle of the ring. He was a long-time user, 20-some years, heroin user, and he was a tree trimmer, never missed a day of work. And he was about to go to prison on some old charges, or he was in jail on some old charges, and they saw that he was caught up in the ring. So they tried to get him to squeal on where he had got it from. He was already in jail. And they said, listen, if you don't tell us who you got this from, we're gonna come back and we're gonna bring even more charges. And he said, F you, bring it. And so that was why they named it. And like the hair stood up on the back of my neck, and I thought, I want to find out more about this ring. So I started interviewing people in prison. It's called Core Links. If they're in federal prison, it's pretty easy to correspond with them. First you write them a letter, and they don't have anything to do, right? So they write you back, and like the guy Keith Marshall who said FUBI, he became one of my best sources. I mean, he explained a lot of the ring to me, including the fact that he had said FUBI, which the prosecutor really didn't want me to put in the book, but come on, that was so good.
So did you feel like you came back with answers for Christy that were satisfying?
Well, I went to interview Ronnie in prison. I was his first visitor. He had been there 2 years. He was, this was his third time in prison. multiple charges. He had been, I mean, it was just a really sad story from a mother, very great mother, a broken family, but he had a lot of support as a young kid. His brother is a very successful rap artist and music producer. He was very frustrated with Ronnie. Ronnie had already been into prison twice, and he had helped him each time he had gotten out. And as Ronnie tells the story, Ronnie, like many people in the book, did not really take responsibility for what he had caused to happen. And but the other side of that story is, what did we do for Ronnie when he got out of jail? I mean, he basically, the reason he landed in this pristine, mostly white, almost entirely white farm village in the northern Shenandoah Valley was they had sent him to serve out the tail end of his last prison sentence to work in a chicken plant. And at the end of his sentence, he decided to stay in the town. And he lost his job. He got sick, and he lost his job. And then he had tried to get other work. He tried to rent a space to open a computer repair shop. And it's just really hard for felons to get jobs. He had child support arrears. He had court fines. In Virginia, you can't get food stamps if you're a felon. So he went back to what he knew, which was dealing, before he had dealt, marijuana and crack. And he remembered somebody saying to him at the break room of George's Chicken, if you really want to make money, look around you. Everybody here is doing pills. And the pills are getting harder to get. This was after Purdue had finally reformulated OxyContin, hydrocodone got upscheduled. And he said, if you could bring heroin in, you can make a lot of money. And so he got a connection up in Harlem, and he started mainly paying addicted users, many of them females, to take the Chinatown bus to Harlem, and would bring the heroin back on these unusual hockey puck shaped discs that fit stacked up inside of a Pringles can. And so these women would bring them back in like Walmart bags, and it just looked like snacks. And he made a lot of money.
One of the changes that you talk about is in the medical community, right around the time OxyContin's coming out, and doctors are worried about pain, and they're calling it the fifth vital sign.
Yeah.
Where did that come from? And
I think it initially grew out of the hospice movement in the 80s, and then you had a lot of articles about pain being undertreated. I mean, sure, some of them were legitimate, but also, this was at a time that managed care was becoming a big thing with insurance, and much more likely to cover pills than they were physical therapy, occupational therapy, acupuncture, and things like that. And then you had medical advertising on TV, commercials, not opioids, but all the other commercials. So you had this whole movement of the patient being the consumer. And so I saw this drug on TV, and that's what I need, that kind of thing. And then Purdue takes advantage of that. There was this thing called the Joint Commission on Hospital Accreditation that also put forth this idea that we're going to rate you, we're going to let the patient rate us, the hospital, on how we treated your pain, and then the reimbursements will be tied to that. So doctors felt like, they had to rate, to treat people's pain, but it was so subjective because one person's stubbed toe might be another person's transition labor, right? I mean, and then people quickly realized that they could say their pain was a 10 when it wasn't. And Purdue, you can see it right there in their budget plans. They were all prepared to take advantage of this pain as a fifth vital sign. They sent 5,000 doctors, nurses, and pharmacists to become paid speakers to places like Florida, Arizona. They paid them to go back into their communities and be speakers for the drug. I mean, they were wearing OxyContin branded beach hats at the same time these children were overdosing in the library of some of these rural communities. And I argue in the book that because these were politically unimportant places, The media was declining at the same time. I mean, my own newspaper rarely ventured into Central Appalachia, unlike in years past, that the epidemic was allowed to fester and grow because it began in those distressed rural communities.
You quote an attorney in the book who says something to the effect of these doctors were prostituting themselves for a few trips to Florida. Is that a fair comment about what the medical community was doing?
It's a good quote, right? It's pretty sharp.
That's why I noted it.
Right. Yeah, you're like, oh, that's a good quote. Well, the doctors were taking a lot of free stuff from not just opioid makers, but all pharmaceutical companies were sending reps in, and they were, these reps would be kind of on the younger side of middle age, very good looking, free meals almost at every lunch. And I mean, to his point, Emmett Erie, and he filed one of the early civil cases against Purdue and lost. Where were the ethics in that? I profiled one doctor who didn't want to do it, and he said, you guys, this is wrong. We shouldn't even be accepting Post-it notes and pens that are branded. And his colleague said, well, what about the staff? They'll miss their free lunches. And this doesn't happen to this extent anymore. I think they stopped doing that in the mid-aughts, and now, as part of healthcare reform, it has to be reported. It, has to be on a website so anybody can see who's doing this. But they're still doing the free lunches. And I don't know about you, but in journalism, I was taught that we didn't accept free things. If somebody would send me some flowers after I had done a story on them and they liked the story, as a policy, we gave those flowers to domestic violence shelter. I mean, and doctors didn't know that was wrong to accept all those things. I mean, they did dine and dash. They would bring you Christmas trees. I mean, anything they could get. They would find out what you liked. If you liked Cuban cigars, they would show up with Cuban cigars, all to get a little bit of your time to give the pitch about whatever drug. There's a doctor in Wytheville, Virginia, who was a chain smoker, and one of the reps shows up, and he was going to bring her a carton of cigarettes, and the rep before him already beat her. And there's a carton of cigarettes with a Celexa sticker. And she had a sign-up sheet. Her kid was about to turn 13, and there was a sign-up sheet. Did a rep want to sponsor her kid's party to go to Carowinds Amusement Park? I mean, you couldn't make that up.
One of the heroes in your story is a doctor, Art Van Zee. Talk about what he was doing and how he responded to this very early on.
Yeah, so he's from tiny St. Charles, Virginia, in Lee County, the westernmost county, and he works at a federally qualified health clinic, so a sliding scale. And he's a Vanderbilt educated minister's son. He looks like Abraham Lincoln, really tall and skinny, beard. Sweet guy, very self-effacing. And he said before OxyContin came out, he had 1, 2, or maybe 3 drug-dependent patients a year. And then after OxyContin came out, he was being summoned to the ER late at night for children whom he had immunized as babies for overdoses. I mean, he's the one that was his patient overload, just his caseload became overwhelmed with this drug. So he was the first physician that I could find in the country that called them on the phone and said, look, I know on your insert here it says addiction is exquisitely rare, and the time release mechanism is believed to reduce the liability of abuse, but we've got high schoolers ODing in the library. And he wrote them a letter in 2000, and he said, my fear is that these rural distressed communities where crime is skyrocketing and overdose deaths are going up, that these communities are sentinel areas the way New York and San Francisco were in the early years of HIV. And of course he was right. And he told me when I first met him in 2016, he said, I thought when this epidemic hit the cities and suburbs, and it wasn't just a bunch of poor kids in the country dying, poor kids in the mountains, I thought people would take it seriously, but I was absolutely wrong about that too.
And he would engage directly with Purdue's representatives, even their top executives at meetings, to describe some of the interactions that he had.
Oh yeah, they had, I mean, he started this Lee Coalition for Health. He had community meetings, 800 people in the high school auditorium. A Purdue person was in the back and stood up, and, you know, he invited them to town. At one point, he had a banker in the town meet with them, and just to tell the story of how his son had blown through their entire 401k. They had stolen everything, and you know, they were about to go broke, thinking that that would make an impact, and it didn't. He begged them to take it off the market until it could be reformulated to be abuse resistant. And they said they were trying. They did not reformulate it until 2010, 14 years after it came out. He believes that at any point, he believes the trajectory could have been slowed if they would have done that, much like the makers of another opioid called Talwin had done years prior, had taken it off the market, then reformulated it, and then put it back to be abuse deterrent. So many things. In 2007, the company, the federal government, they've been investigating the company since, I think, 2002. So for 5 years, there's a sentencing hearing in Abingdon, Virginia, which is near the Virginia coal fields. And he also organizes a protest of all the parents from across the country who have lost, or many of the parents who have lost children to OxyContin overdoses. And so he's just there at every juncture trying to help these people. And he's been an MAT, or medication-assisted treatment, Suboxone prescriber mainly, since it came out on the market too. So now he mainly deals with opioid addiction. That's most of his practice now. And he works 14, 16-hour days. I was just down there a couple weeks ago. PBS NewsHour came and wanted me to go down there with them. And he would only meet us after all the patients left, 7:30 at night, down these curvy roads in the mountains. I mean, those boys from New York didn't know what hit them. And I said to the receptionist, "Sorry to keep you so late." And she said, "Oh, some nights I'm here until 10:30. He's still with his patients.
I think one of the things that's so striking about your book is the amount of failure at every level and in most of our institutions, government, the politics, the courts, just everywhere. What surprised you the most in looking at the broad sweep of this in terms of our inability to respond?
Yeah. I mean, I guess I didn't realize how bad it was when it was OxyContin in the coal fields either, although I was reading the articles and in my own newspaper, my colleague was covering it. And when and then I follow young people now, several people I followed over the course of a couple years that have been active with heroin in more recent years. And I guess what surprised me is when you look at them now, and many of them are involved in drug gang activity, prostitution, homelessness. I mean, these are people from some of the nicest neighborhoods in Roanoke where I live. It was all happening back in the coal fields. It's the exact same thing. Same exact story. That drive not to be dope sick will cause people to do just about anything. To lose their child, to lose their family, to steal from their parents, to take meth and get in horrible fights with their parents. It's the same story, but we miss it until it's like right there in front of us.
Maybe we should explain clearly what dope sick means.
So dope sick is the word that users call the feeling of withdrawal, which they all say almost to a person is the worst flu times 100. It's diarrhea, nausea, vomiting, restless leg, and it's this outsized feeling of this crushing pain. One user told me when he was in the throes of it, he said, if it was Monday and I knew my dealer wasn't coming to Friday and I only had 40 bags of heroin to last me to Friday, I would apportion it out and give myself a little window at the end, because the worst thing is always, you don't want to be dope sick. And we called it dope sick just because it's in your face. I mean, that's the word they use. It's what's driving it, you know?
So tell us about some of the other people who are helping, like Dr. Van Zee, and what they're doing and what kind of success they're having.
Yeah, so in Roanoke, I followed the travails of this project called the HOPE Initiative, which is located at a free clinic for the working poor. And it's mainly a group of, in the beginning, it's mainly a group of healthcare professionals, but also mothers who have lost children, really well-meaning recovery advocates. And it's also a place where, at first they had it every Monday afternoon, and you could come and the police would refer people that they thought really didn't need to go to jail, they need to go to treatment instead. But in Virginia, it's based on a program out of Gloucester, Massachusetts. The police chief started it there. But unlike in Massachusetts, where they had much better access to, they had Medicaid expansion, right? But Virginia just passed Medicaid expansion a couple months ago, and it hasn't even trickled down yet. But they had much better access to medication-assisted treatment, to rehab facilities, to insurance. And so what I saw over and over with this program in Virginia is people would be referred to typically out-of-state treatment centers that were abstinence only. And I saw people relapse and die after they were not successful at those facilities. And it's one of the big messages of the book. Everybody experiences addiction differently, and what works for somebody might not always work for somebody else, but the data is very, very clear that medication-assisted treatment, particularly buprenorphine and methadone, are the best tools in the toolbox for preventing overdose deaths. So 50 to 60% better at preventing overdose deaths than abstinence only, which is 10 or 11%. So, but people, Tess Henry, who the woman I followed for the longest, I watched her be denied that just over and over. I would drive her to NA meetings, which were initially a condition of her buprenorphine program that she was on. She had to get it signed by the meeting leader. And then when she would go up and ask people to sponsor her at the end, and then they heard she was on buprenorphine, they consider her unclean because they thought she was just, substituting one drug with another. So I think that remains one of the biggest hurdles to turning this epidemic around. More than half of the rehab centers in America don't allow MAT. I think that's starting to change.
Why is that?
For the same reason I said.
Because of a stigma?
Because many of them were developed historically around AA and NA, an abstinence-only model, and they believe it's substituting one drug with another, and that you're not truly clean unless you're abstinent. And so in the states, in these recent numbers I was just talking about, 72,000 people died last year, 10% increase from the year before. In the 3 states that you started to see slight decreases, which were Vermont, Massachusetts, and Rhode Island, what's driving the slight decrease is access to MAT, particularly ER.
We should say what MAT is.
Buprenorphine or methadone. So that is, it is a weaker opioid. It is an opioid, but it's a blocker, and if taken correctly, doesn't get you high, and it reduces cravings for people. And in the meantime, if you talk to Dr. Van Zee's patients, because he has some patients who've been on it 6 and 8 years, they're getting their jobs back, they're getting their families back, they're getting their lives together. Some of them out in the coal fields are now getting off disability, which is almost unheard of. And
who would have to be persuaded for this to change? Is it the clinicians running the rehab centers, or the culture of AA, or How is that view, how does it kind of
I think it's
hold
slowly starting to change, but if you look in my book, the few people who are successful at the end of the story of my book and are on MAT, like they don't want to give their names because there's still such a stigma about it, like what Tess experienced. And there aren't enough doctors willing to become waivered to prescribe buprenorphine. It requires I believe it's an 8-hour course and DEA approval. It's a bit laborious. And so you have lots and lots of waiting lists. I mean, that was one of Tess's issues is she would only, she couldn't get off the waiting list. Dr. Van Zee has a 2-year-long waiting list. And I mean, what's happening to those people? A lot of doctors don't want, quote, addicts in their waiting rooms. Well, sorry, you already have addicts in your waiting room. And France, which removed the waiver requirement when they were having a big heroin epidemic in the 80s, they made it so any doctor who's a doctor that can prescribe anything, like opioids, doesn't have to have special training to prescribe buprenorphine, and they increased their capacity tenfold, and their overdose rates went down 87%. So that would be another good place to start, is to take that waiver away, requirement away.
So how did you deal with being immersed in so much tragedy for so many years and turn out this book?
Well, I did it by focusing on the heroes. I had a lot of help from my friends. One of them's here. Where is she? Where is she? Where's Martha? Come on, put your hand up so I can see you. I don't see her. So my best friend Martha's here. She's a WBUR healthcare reporter in Boston. We were Neiman Fellows together, and Bob and Nancy Giles brought us together because he was the Neiman curator. And she is the most fierce, amazing reporter. And so she did things like, I would call her up when I was really depressed, and she'd say, honey, you have to meditate. You have to go to your yoga. You have to, and then when I got my edits dumped on me, I don't want to say dumped because they were great edits, but they were kind of overwhelming. They might have been 6 pages, single-spaced questions, about 1/4 of which I could answer. And they might have been due like 3 weeks later. And I couldn't sleep. I was just panicking. I mean, I might have been crying and not sleeping. And I called Martha up and I sent her the 6-page memo whose questions I couldn't answer. And she said, honey, you don't have time to have a panic attack. She said, I want you to take a picture of Jesse. He's the boy at the beginning who overdosed on somebody else's bathroom floor. I want you to print it out, put it above your desk, and I want you to put 175 and 250. 175 is how many people are dying right now a day, and 250 is where we're going to be in not long if we don't get our arms around this. You don't have time to have a panic attack. And then, not just that emotional support, but she also created a Google Doc on the cost of the opioid epidemic. She stayed up until 3 in the morning creating all these links of data, answering some of my editor's questions. So how about that for a friend, people? And then my husband, can I give a shout out to my husband? He's not here, but he might watch this later. My editor said, I want chapter 13 to be the prologue. What? That's when I go to interview Ronnie in prison. I said, what? That didn't come until the end. She goes, I know. So that I was like, how do I do that? How do I do that? And my husband said, well, what were you thinking as you were driving to the prison? And what were you driving by? Well, I was driving by Civil War battlefields where the first morphine epidemic had been seeded. So that was, I could work some history in there. I was driving by Hidden Valley, the suburb where the kids first started using heroin in a big way in Roanoke, and because it was an upper middle class and people had the money to hide it, it was allowed to fester and grow. I was driving by some of these rural communities on the way, and so it allowed me, it sort of gave me this vehicle for setting up the different tangents in the story as I was driving there, and that was my husband's idea. And no, I have a really great team of journalists and friends and people that help me when I get stuck. And then I had the trust, if I could just tell the story of this one mother. So her daughter, I got her picture right here. Her name's Tess Henry. She was 28 when she died. I met her when she was 26, and she had just had a baby. She was the one who lost her access to Medicaid and her access to MAT. And I watched her as she bounced from homelessness to, well, first she was living with her mother, and then she lost custody of her child and she lost her insurance. Then she was in and out of rehab, psych centers, domestic violence shelters, jail, psych centers. And then they sent her away to an abstinence-only rehab in Las Vegas. And so after her death, her mother gave me this necklace, which has an E.E. Cummings poem on the front inscribed. It says, I carry your heart in my heart, because Tess wanted to get home to be a mother again to her son. And she wanted to get clean so bad. She wanted to get better to raise her son. And so her mother has this matching necklace, this tree of life, which Tess had tattooed on her back, which was one of the ways they identified her body. When they found her, she was murdered. Her body was found in a dumpster on Christmas Eve, and her murder remains unsolved. It was probably related to prostitution or drug gangs. She had been living homeless, sleeping in the corners of casinos in an abandoned minivan, and she was under the thumb of some pretty bad people, we think. And so anyways, I put Tessa's picture with her rescue dogs on one side. She loved her dogs. And I put James Baldwin on the other, because James Baldwin said, not everything that is faced can be changed, but nothing can be changed until it is faced. And I think that's what Tess would want. I think she would want people to know her story. The very first time I went up the mountain to interview her and her mother at the beautiful home overlooking the Blue Ridge Mountains, they both wanted me to see what they were going through and how hard it was for them to get treatment. Her mother's a hospital nurse, her dad's a surgeon. These are not people without resources. And even this happens in every family, at every income level. And Tess, who wanted to be a writer, she had published her first poem at the age of 16. She was an honor roll student, a French major at Virginia Tech. She wanted people to see what was happening with her and how hard it was for her to get treatment. She had initially been prescribed 2 opioids, 30-day opioids, at an urgent care center for a simple case of bronchitis. And what she said was, I think what we need is an urgent care center for the addicted. And if you think about that, that's what's happening in these states that are starting to turn their overdose rates down. They're having access to syringe exchange and recovery programs, ER access to MAT, and they're just providing easy portals for people to get access for their addiction.
Tess's mom, Patricia, was notable in that she was, you portray her as almost entirely unflinching in the face of all this, to the point of talking to every reporter who called her after her daughter's gruesome death. Where does she get her fortitude, do you think?
Well, she's a woman of great faith, and she's very close with her father, who's 86 and was there with her. She and her husband have been long divorced, and it was her dad and her and me, and the rest of the family pretty much thought Tess just needed tough love. She was making poor choices. They didn't really understand the concept of dope, sick, and addiction, and they definitely didn't understand the concept of MAT. So you saw a family divided about the best way forward, and she felt like the black sheep. But Patricia's strength, I don't know where she gets it from. I have been doing this for 30-some years, and I've never had somebody just be so open, and because she understands that the stigma is what's preventing us from taking a hard look at this. She said we should pull it out from the rug. We should talk about this the way we talk about cancer. And heart attacks. If you were having a heart attack and you went to the ER, they would race you up and spend a lot of money on your treatment. But if you go to the ER and you've had an overdose, too often they just send you home with a tired Xerox for a 12-step meeting. It just depends on where you live in this country, whether or not you have access to these life-saving treatments. And we know that rural overdose deaths are still among the highest.
You said either in an interview or in the book that we haven't even come close to reaching the apex yet.
Don Burke out of University of Pittsburgh, who's really studied this, he's the one that pointed out that we've lost 300 people in the last 15 years, and we're going to lose that many in the next 5. So that shows you, it's a line like that. I said, well, when's it going to plateau? Sometime after 2020. So, I mean, we're still going up. We went up 10% last year from the year before.
So your book has been very successful. My in-laws were very impressed that I would be up here with you because they saw you on PBS. And you've been pretty much everywhere else. You were on Fresh Air. I'm
at Traverse City, man.
And now you're in Traverse City with
Heck yeah.
400 or 500 people.
I know. I love this.
What do you think your book can do?
Well, I hope it mobilizes people to change, to care. I hope and to change. I hope it mobilizes people to care about who they vote for. Do you have a drug court in your town? If you don't, why don't you? Who could you call? Do you have a syringe exchange and recovery program in your town? Or if you're in my town, your police chief has come out against it, so you don't. So we should be calling our city council members and our city managers, and we should be electing prosecutors and Commonwealth attorneys who are open to these. Every single scientific study says that this is the way forward if we care about preventing overdose deaths. So, we need to be voting in people who are going to take this seriously. And I'm hoping. I'm hoping my friend Robert Gipe, he's a novelist in Appalachia, just wrote a profile of him for Oxford American magazine. He sort of helped me through this book too. I would call him up every now and then. He's been writing books and plays set against the backdrop of the OxyContin epidemic since 2005. And I think you should get a MacArthur Genius grant. So I would call him every now and then just to say, Robert, give me some hope. I need some hope. How do you get through this? And he's like, I don't know, I'm not sleeping at night either. And, he's starting to see people change about harm reduction. So one of the plays he just did was called Needleworks. And he's out of Harlan, Kentucky. And so what he does is he collects these story circles. He gets his students in his Appalachian Studies program to interview people in their communities. This is something you can do right here. And then they basically put on a play. They have their own theater troupe now called Higher Ground. And the concept was like, when floods would happen in the coal mining towns, and those were times when people came together, and it didn't matter if you're Democrat or Republican, you're helping each other out, and that's sort of the metaphor they're working with. So they did this play around, they collected all these stories, mainly of kids, teenagers, young people who were just sick to death of their addicted parents. And my dad killed my dog in a rage one night. All these horrible stories. And they were talking about the concept of having a syringe exchange in recovery. And of course, now you have this hepatitis C tsunami happening. A lot of people don't even know they have it. And so he collected all these stories, many of which were critical of the users themselves, and then they made a play featuring the main character was running a renegade syringe exchange out of her mountain holler. And at the end, she gets arrested. And then they break the fourth wall and they say, what do you think should happen? Should Betty go to jail, or should our community be providing a syringe exchange? And so then they have this dialogue, and the local health department director is up on the stage, and the whole community's talking about it, which is really cool. And the first syringe exchange to finally open in Virginia was in one of these places where the play happened. So that's really cool. I mean, we've got to get out there, and as Robert says, we've got to pry open some hearts.
Why don't we go to the audience? Take a few questions. We have people with microphones who will come around. We really need you on a microphone.
Perfect.
Hi,
Hi.
I'm glad you're here. I love your book.
Thank you.
A lot of good information, and I agree with a lot of it, so I feel like it's good information, right? I work in the field as a provider, and we do have drug court in this town. We've had it for about a year and a half, and are seeing some results.
Great.
However, we are not providing MAT for those in drug court. Mm-hmm. And that's because we have a judge that doesn't believe in MAT. Mm-hmm. And, you know, frankly, there are a lot of people that don't believe in global warming. But the research says that that's what's happening. Mm-hmm. Mm-hmm. And so I guess I just wanted to let people know in the audience that we do have a drug court in 86th District Court, and it is working.
That's great.
And it is, yeah, it is.
Well, just keep trying to inform people. You know, one of the drug courts I follow in the book, if you've already read it,
yeah.
They eventually start allowing Vivitrol, and I think eventually they'll allow buprenorphine, which has a little better numbers, success rate.
We do allow Vivitrol.
Yeah.
Or the drug court does allow Vivitrol.
Okay. Okay. It's more expensive. It's $1,000,
yes.
and it only lasts 28
does not
days.
allow the Suboxone.
The thing with law enforcement, and I have a friend who's a rural judge. He's a novelist and a rural judge, and a really good friend of mine. And he said, I read your book. I really liked it. He goes, I'm one of those climate change deniers. I don't allow MAT in my drug court because every time I do, they sell it to buy methamphetamine. Well, I don't believe that's every time. And what I said was, Martin, you're only seeing the bad examples. It's an observation bias. You're not seeing the people who are using it correctly and who are doing it in conjunction with counseling, and we've got to do better on that.
I may be jumping ahead, but my question is, in the treatment methods, cognitive therapy, medicine, but I've been reading about the chemistry of the brain. National Geographic magazine, I think it was in 2016 or 17 in the fall, published quite a study on the brain on drugs, showing how addiction hits the brain to the craving is so strong, plus you have the actual examples. But there is also another study that I read about in Europe, Italy, a young man that tried everything but couldn't succeed at escaping until they tried electrical external stimulation called TMS. Are you familiar with that?
I'm not.
Okay. It's trans mechanical stimulation.
Okay. And for opioid addiction?
Yes.
Oh, okay.
And I was going to ask your opinion on it, but I guess we'll have to research it a
Well,
little
like I
more.
said, different things work for different people. There are people in my book for whom months of rehab work followed by months of aftercare without MAT, but those people, parents spent $300,000 on their treatment. So I think the low-hanging fruit in this country is to create these portals for access to MAT because it's affordable, you can stay in your home community, you're not gonna be out on the streets of Las Vegas, God knows where.
I would just like to add, you can find out almost anything on Google.
Okay, good to know.
Let's go up top.
Up here.
Hello. First of all, thank you very much for the tenacity and clarity that you brought to an issue that obviously touches the hearts of, unfortunately, an increasing number of Americans. I can't be helped but struck by the parallels between the issue that we're talking about here tonight and one that I've looked at since 1985. And apropos of this first question, 1985, I was at the first conference called by Al Gore in Washington on the issue of global warming. Over 30 years ago, and I've dealt with my full complement of global warming deniers of global climate change, and it's a hard thing to deal with, believe me, even at this stage where we have it at the highest levels. But I can't be helped but struck by the parallels here. Global warming issues showed up, of course, in the most vulnerable communities. As you've noted here, those communities that were ravaged by problems in the economy, loss of jobs, and so on, those are the most vulnerable ones where this started. If we had paid attention then to those people, maybe this would not have become so widespread. My question to you has to do with getting at the root of the problem. I'm reminded of Henry David Thoreau's quote about there's 1,000 people hacking at the branches of evil for everyone hacking at the roots. And to me, the root of this goes far beyond where most people are willing to look at. And that is, we live in a society with an economy that basically is commodifying everything, including people's lives. You know, consumerism that is out of control. And this is much harder for people to look at than even the opioid crisis, because the opioid crisis can be more easily personalized. You know, we can hear these heartrending stories of people. We know people who have been involved in that. And it's a lot harder with global warming, for example. But I would say the commonality here, if we want to get to the root of this crisis, of a number of crises that we could talk about today, we have to go back to a bigger understanding of how do we change the basic economic structure of the society we live in that makes all of us disposable commodities, especially the most vulnerable among us. And this
Okay,
is
let's
something,
let her respond.
Yeah, and this
Let's
is
give her a
something
chance.
people have a hard, well, I say, I try to spin this out because I've spoken myself at dozens of places.
Do you have a question?
People
or?
ignore it. Yeah. To what degree have you looked at going more deeply into understanding the real roots of this issue, and do you think that that's going to be a productive way for people to understand that and link it with other important issues?
Okay, thanks.
I do. My first book was looking at the aftermath of globalization. It was called Factory Man, and it was the story of a furniture maker that sued China in a court of international trade to keep his furniture company going, and he basically saved this town. And this town happens to be very much standing in for these distressed rural communities. Number 3rd highest opioid rate prescribing in the country. And we haven't talked about this yet, I talk about it at length in the book. A lot of what was drawing these reps and these doctors to these rural communities weren't just incidents of workplace injuries, but it also took off like a wildfire in these distressed communities because the jobs were going away and people realized that OxyContin not only numbed pain, psychic pain, but you could sell it on the black market. You could get $1 a milligram for it. And so it became almost like moonshine, like a side hustle. people started selling it to their neighbors. They started talking their doctors into writing them. And so it was very much these two things happening at the same time. But like which do you address first, and which is the easier one to address? I'm trying to give people some solutions at the end of Dope Sick. I'm trying to show them things that communities are doing to try to help with harm reduction efforts. But I'm also trying to explain the economics of it at the same time.
Let's have one more question, if we can get a microphone to somebody right here in the front.
Related to that last statement, I'm wondering about the front end, the preventative end, before the addiction occurs, before the opioid is given. I'm wondering, do you see any legislative at state levels action that would compel physicians to offer alternative care, treatments, acupuncture, physical therapy, chiropractic, that type of thing? Are you seeing a change of treatment prior to the opioid given?
Yeah, and I think the CDC guidelines, which are just a recommendation, but they came out in 2016, they very clear that they don't want you to start out with an opioid. They want you to start out with Tylenol and aspirin and only use it in cases of severe pain, cancer, end of life, which is what we did for 100 years, right? Because we had the morphine epidemic in the late 1800s. So for 100 years, we knew that opioids were very addictive, and then Purdue changed the narrative. So I think it's really good that doctors are prescribing fewer opioids now. I think some people are going to the black market, though, as they're getting cut off from their prescribed painkillers. And these, I think we need to think about them too and not overreact the other way. But we still have 2.6 million people with opioid use disorder. So if we arrested every Ronnie Jones in America, we'd still have 2.6 million people with opioid use disorder. And are we gonna just let them dangle out there to die? Because that's what I'm seeing happening. Right. And I'm really hoping this book will, as I say, nudge open a few more hearts to look at providing treatment into communities. And a lot of people don't want these treatment facilities in their backyard, right? They're just like, no, we don't want a methadone clinic here. I tell the story near the end of the book of a rural town in Gray, Tennessee, where this collaboration results in starting a nonprofit methadone clinic using the best science for it, but nobody in the community wants it to come, to the point of almost everybody in this town signs a petition against it. And so this physician leader, who himself is an opioid addict in recovery, opioid user in recovery, he's leading the charge to get them to open it. And he says, Beth, I looked out, they were filming me as I spoke, they were trying to intimidate me, they were saying, put it in your neighborhood. He said, these were people I went to church with and I played ball with. And finally some woman shouts out, she says, how many chances do we give these people? Ouch. And that was the same week that Ohio sheriff had said, let's take all the naloxone away from our deputies because it was sucking the taxpayers dry. I have some people in my own family think that. Narcan, Narcan. So Dr. Lloyd looks out. He sees the church steeples out the windows in the back. He sees these people he played ball with, and he thinks of what the disciple asked Jesus. This is the heart of the Bible Belt. And the disciple asked Jesus, how many times should we forgive a sinner? Should we forgive him 7 times or 70 times? And Jesus says, 7 times 70. And you know what? That methadone clinic opened last August. They haven't had one incident. So that's the proof in the pudding. Now we need to go to the next community and show, look what happened here, right? We can do this if we care about each other and we care about community.
Beth Macy, everybody.
Thank you.